gemination, and we have the fusion. The only difference, the clinical appearance may look like the same. The clinical appearance may look
Okay.
like the same, but cause can be different. You have two enamel organs. You have two enamel organs, and these two enamel organs fuse as the word fusion says. And if they fuse to form a larger tooth that more commonly occur during the macrodontia. Okay, larger size
Gotcha.
tooth. For example, the size of the central incisor is this. During the macrodontia and the fusion, macrodontia is the clinical appearance. You would have a larger mesiodistal dimension
Of crown.
of the
Clinical
crown.
crown.
Okay, and this is so much clinically relevant to us because in orthodontic we are dealing with the aesthetics. If you are dealing with aesthetic
Yeah.
and during the orthodontic treatment you end up with such a larger size tooth that is not aesthetically very pleasing, it should not. This is the serious concern because this is disturbing the aesthetic. Secondly, this is seriously disturbing the bolt-on discrepancy. If you have the larger tooth mass in one arch and a lesser tooth mass in the opposite arch, and you do not have a proportion and you do not have the balance between the tooth sizes of the upper dentition and the lower dentition, this will end up in some overjet, overbite, crowding of the tooth. So, in order to have the normal occlusion or the ideal occlusion, you have to have certain ratio between the upper teeth and upper teeth tooth mass and a lower teeth tooth mass. Without having this normal ratio and proportion between the upper and lower teeth, you cannot have the ideal features of the occlusion like overjet, overbite, midline. You have to have the balance, and these development of the dentition, during the development of the dentition, these condition of the gemination and the fusion is producing a larger mesodistal dimension of the tooth that is greatly impacting the ideal feature of the occlusion, and this is leading toward the malocclusion. And during the diagnosis, we would diagnose if this tooth is larger in size, we slice it to the normal, and if the slicing is disturbing the dentine, we may end up with a crown after the root canal therapy. We do root canal, desensitize the tooth, and we do the crown or veneer around the tooth to have it. We are not discussing the treatment. In the gemination, you have the one enamel organ. Okay, this
Divided.
divide into two, and these two unite together to form a larger size tooth.